One of the most common dental procedures we get is a dental crown. Now, if you don't know what a dental crown is basically like a baseball cap or a helmet for our teeth. So the reason you would need a dental crown is when your tooth is super compromised. So that's when you have a really large cavity or something else going on with the tooth where a large part of the tooth structure is missing. And if a large part of the tooth structure is missing, doing a bigger filling or something to build that tooth up is not going to work anymore. And there's actually a risk that the tooth could break even more. And when a tooth breaks, it's really unpredictable how it breaks. And it could actually do more harm than good to not do a crown. And another time you would need a crown is if you get a root canal done to your tooth. And the reason is anytime you're getting a root canal, you are killing that tooth. And when that happens, you are not allowing any more blood supply to come to that tooth, and that tooth will become a lot more brittle and a lot more prone to breaking. And that's why a lot of the times when you get a root canal, you do need a crown as well to protect it after. Now, you don't always need a crown after a root canal, and usually your dentist will be the one to make this decision. So basically the goal here is to just extend the life of the tooth. We want our teeth to last as long as possible. And the reason is every single one of our teeth are important. Now, sometimes obviously you gotta get your wisdom teeth taken out or something like that. That's a different story. But if you're using a tooth to chew, you wanna definitely keep that tooth. And you will definitely regret not keeping it. Just losing one tooth and not doing anything to replace it will actually do a lot more harm than you think. One is you're gonna be putting a lot more stress on all your other teeth because now you can't chew as much on that side, so every other tooth is having to do more of the work. And also the teeth that surround that missing space, they'll start to drift. And the reason is our teeth are kind of lonely. So when they see a missing space, they will start to move and try to close that gap. So that means the teeth that are on the side of that missing space, they'll start to close in to fill that missing space. And also the tooth that's opposing that missing space, or the tooth that used to bite on that tooth before it left, that tooth will start to grow in more and try to close that space as well. So the problem here is those teeth that start to shift, they're going to become more compromised as well. And one reason is those teeth are going to be a lot harder to clean, because now they're at weird angles and they're growing in a lot more, and there's a lot more there to clean that's harder to get to. And it's not just the teeth we have to worry about. Now we have to worry about the teeth in position to the bone. And sometimes they're in a position where we can get a lot more inflammation around them, and that means we're gonna get a lot more bone loss, and now we're risking losing even more than that just one tooth. And also the longer you wait and the more that these teeth close that missing space, the harder it's going to be to fill that missing space in the future. Now that's enough about that topic. We know what a crown is and we know why we would get one. So what exactly is crown lengthening and when would we need that? So really crown lengthening is exactly what it sounds like. You are lengthening the crown of the tooth. Now a tooth really simply is broken down into two parts: the crown of the tooth and the root of the tooth. The crown of the tooth is the part that sticks up above the gums. And the root of the tooth is the part of the tooth that is embedded in the bone. So it's kind of like a tree. You know, the top part of the tree is the part that's beautiful, the part that we like to take pictures with, and the root is the part that's embedded into the ground and supporting that tree. So the way you do a crown lengthening is you're basically turning some of that root of your tooth into the crown. And how is this done? Well, it's done by removing some of the bone that's around that tooth and lowering your gums. So this is a surgical procedure, but it's one of the more minor surgical procedures we can do in the mouth. So why on earth would we need to do crown lengthening? Well, if your tooth, again, is really compromised, let's say there's a huge cavity, or the tooth is broken down in a way where it's really hard to fix, sometimes there's not enough room above the gums to make a crown. And that's why sometimes you need to have more tooth structure to work with to make a good result. So for example, if you have a cavity that's really big and it's close to the bone that surrounds that tooth, now doing a crown here or a filling in this situation is going to be really unpredictable. And let's say we do a crown anyway, and even though it's super close to the bone that surrounds that tooth, we're still able to get a good result. Well, you can have some other issues with this tooth as well, because we need to have some space in between the bone in our jaw and any filling or crown material we're going to do. They can't be right next to each other. And if they are, it's going to cause a lot of inflammation, and now you can have a lot of other problems going on in that area. So that's why when we do crown lengthening and we remove some of that bone, we lower those gums, and now we're able to have healthy tooth structure to work with, and we're going to be at a safe distance away from that bone. This is a lot more predictable. But if you need crown lengthening, I would definitely advise you to consider all your options. Because usually the reason that you need crown lengthening is because there's a lot of issues and that tooth is really compromised in the first place. And usually crown lengthening alone isn't enough. You're probably going to need multiple procedures done just to save that one tooth. For example, a lot of the times when you have decay that's really close to the bone, that means it's into the nerve of your tooth as well. Now, the nerve in your tooth is located in the center of your tooth. It's also called the pulp. And you also get your blood supply that keeps the tooth alive here as well. Now, if your cavity has spread here, now you're going to need a root canal as well. So now we're talking about multiple procedures. We're talking about crown lengthening, which is going to lengthen that crown and give us more space to work with. We're talking about a root canal to get rid of that infection in that tooth and get rid of the nerve in that tooth. And we're talking about something called a core buildup, which is basically a filling material that we put underneath the crown. And that's basically because when we do a crown, we need to have some tooth structure or something solid to work with. We can't just remove all that decay, have a giant hole, and put a crown over it. So that's why you need to do something called a core buildup, which is the core that is underneath the crown. And obviously the last thing you'll need is a crown. So that means you're going to be spending in the thousands of dollars for sure. Every place is different, and if you go to a specialist, the fees are going to be a little different too. So now you got to ask yourself, like, is it worth it to spend all this money to save this one tooth? And, to a lot of people, it wouldn't be, and to a lot of people, it would be. You really got to make that decision yourself. Like I said before, if you don't have any tooth there, it's going to cause a lot more damage than you're going to think. But at the same time, I know finances can be tight a lot of the times, and putting all that money into just one tooth, sometimes you have other stuff to take care of with that money. Now, let's say you want to spend the money, or you do have enough money to save this tooth. Now, is it still worth it? Well, there may be a better option out there. Now, let's picture a scenario. You spend all this money and do all these procedures just to save that one tooth. Now, let's say one of those procedures fails. Like, let's say the root canal fails. Or let's say the tooth just fractures or something breaks and now the tooth is no longer savable. Well, now you're down a lot of money and now that tooth has to go. So if it's a really compromised tooth and going through all these procedures is still going to get you a questionable result, I would probably advise you to go a different route. And a different route would be to just simply take that tooth out and do an implant. An implant is the best thing we have to replace a missing tooth. Now, what exactly is a dental implant? Well, I have some other videos on that, and I'll put a couple links in the description below. But in a nutshell, an implant is basically a titanium screw that's screwed into your bone. Now, this screw is basically mimicking the root of your tooth. And on top of that implant, we would attach a crown. So you basically have a brand new tooth. Now, our God-given teeth are our best possible option, always. But if it's a really unpredictable case, an implant is usually going to be better. And dental implants are really predictable. They have a really good long-term success. And research backs this up because there's studies that go on for like 10 plus years, and most of those implants are perfectly fine. And a lot of the times after some years, when people get a dental implant, they don't even remember which tooth is the implant and which teeth are their normal teeth. But every case is different. So sometimes going through crown lengthening and all those procedures are the better way to go, and sometimes going with the dental implant is the best way to go. You really got to talk with your dentist, weigh out your options, and see which one is best for you. Now, when else can we do crown lengthening? Is it only in these situations where the teeth are so broken down? Well, no, there's actually another scenario as well. Another time we can use crown lengthening is in aesthetic cases. So these are cases where you have a really gummy smile. And what do I mean by a gummy smile? Well, it's literally that. When you smile and instead of seeing all your teeth, you're seeing mostly your gums. So you might think like, oh, I'm just born like that, or my teeth are just shorter. Well, there's actually a way to fix this. A lot of the times, all you need to do is just remove some of the bone that's around those teeth and move those gums up so that now you can see more of the tooth structure. Now, you might be asking, why can't I just move the gums up without cutting some of the bone away? Well, a lot of the times, if you don't remove the bone as well, those gums will just regrow. Now, you might just think like, this is barbaric. Well, actually, it's pretty predictable, and a lot of the patients are super happy afterwards. And if you're wondering if this hurts, well, during the procedure, it's not gonna hurt because you're under anesthesia, whether it be local anesthesia or you wanna go one step further, like IV sedation or even general anesthesia. But really, it's a minor surgery. It's not like you're doing anything too crazy, and your body can heal really well afterwards. Thank you guys for watching. I hope you liked that video, and if you haven't already, please hit the thumbs up button and subscribe to my channel below, and I'll see you in the next video.